Started. Thank you everyone for joining us. So good morning, esteemed guests, and welcome to this vital installment of the SCAGO Summit. My name is Florence, the media coordinator for SCAGO, and I'm delighted to be your moderator for today's session titled Cannabis and Sickle Cell Care. This session is poised to shed light on the latest insights at the intersection of cannabis research and sickle cell disease pain management. Before we proceed, I'd like to make a note for all attendees. If you find today's discussion informative and wish to revisit any part of it, we will be posting and recording on our website at sicklecellanemia.ca. I want to remind you that the information shared in this session does not constitute as medical advice. Today's session will illuminate the pioneering work of our distinguished speakers. We are privileged to hear from Ika Washington, an esteemed public health advocate who has been instrumental in advocating for the underserved communities within Canada. Her dedication to health equity, particularly within the cannabis sector, is both inspiring and impactful. Ika's vision for an equitable health system resonates with all of us who understand that healthcare is a right, not a privilege. Following Ika, we welcome Shan to the platform. Shan May's extensive background as a nurse practitioner and a medical cannabis consultant equips her with a unique lens, through which we can view the role of cannabis in healthcare. Her integrated approach to medicine, combining traditional practices with modern healthcare, brings a diverse and deeply insightful perspective to our topic of discussion. As we set the stage for an engaging and informative session, let us also establish some housekeeping rules to ensure a smooth and respectful experience for everyone involved. Please take note of the following. During the webinar, all participants' microphones will be disabled to ensure clarity and minimize interruptions. Should you wish to ask a question or contribute to the discussion, we invite you to utilize the chat or Q&A function or signal us by raising your hand virtually. We are committed to addressing as many questions as time allows. We are providing translation captioning for the session, so you can listen to it in your preferred language. To do this, please click Show Caption at the bottom of your screen, check the Enable Translation checkbox, and choose your language of choice. We advocate for a respectful and inclusive environment. As such, please ensure that your language in the chat remains appropriate, avoid profanity, inappropriate images, and off-topic posts. To maintain focus, we request that all shared content be relevant to today's discussion topic. Lastly, while we encourage active participation and dialogue, SCAGO reserves the right to pause the session or remove any participants who do not adhere to these guidelines. Following these rules will help us maintain a constructive and educational space. We are here to learn from each other and to foster a community united by our shared interest in improving care for those affected by sickle cell disease. With that, I'm excited to invite our first speaker, Ika Washington, to the platform. Please join me in welcoming her to what promises to be an enlightening conversation. Take it away.
Thank you so much, Flo. So I'm just going to share my screen and hopefully I don't go over because I tend to talk a lot. So you can let me know if you see my screen. Does everybody see it? Can you see the screen? Yeah. Okay, cool. So today's conversation that I'll be discussing is on cannabis in care and from a patient-centered perspective and on managing symptoms. And I just have a few disclosure. So I have no disclosure in terms of conflict of interest or funding. And this presentation is solely mine. I am not a health professional, so I'm not going to be giving health advice, as well as it doesn't represent any opinions or positions of any clients or employers. And I'll only be discussing medical cannabis and approved adult use for medical cannabis within Canada's guidelines. So I want us to start here in terms of moving away from these typical stereotypes of a cannabis user or consumer or patient. As many of you may or may not know, this is not what your typical cannabis patient looks like, even myself as one. This is definitely not what I look like on a daily basis or ever, but I just want to move away from the stigma and stereotypes associated with cannabis in itself. So for those who do not know, actually, that cannabis is actually a plant. It's also known as marijuana or ganja. And it's a plant that's a flowering plant and it's been used for various purposes for over tens of thousands of years. It is indigenous to the Himalayan regions in Asia, and it's now grown globally. Its historical context in terms of being utilized for medicine, dating back from like ancient Chinese civilization, also industrial in terms of hemp use, as well as for spiritual use and also recreational purposes, which we're familiar with. And also it's a plant that's often characterized by its distinct leaves and the different strains, as well as species of the plant that offer different chemical profiles. And just as a 101, as we get a little bit more in depth, and I also think that Shan may also will be talking a little bit about cannabinoids in itself. But when we talk about cannabis, we're also talking about the active components of cannabis, which are also known as cannabinoids. So those that are familiar with the word saying like THC, CBD, what we mean is these active ingredient or components of the cannabis plant. And THC obviously is the most common, which is responsible for the intoxicating high feeling, and CBD, which is also well known, is non-intoxicating, and it has a range of potential therapeutic benefits. And then there's also other cannabinoids. I think there's over 130 and counting in terms of cannabinoids, which are also known as minor cannabinoids. And there's also other components of the plant. One specifically are terpenes, and that is usually responsible for the flavors and fragrances that we smell in terms of cannabis as well. And also another 101, as we continue to talk about cannabis, is talking about the endocannabinoid system. So cannabis interacts with the body, and the endocannabinoid system is within most mammals in terms of having it to be a complex regulatory network that plays a crucial role in maintaining balance and homeostasis within the body. So both THC and CBD that we would be consuming through cannabis actually interact with the endocannabinoid systems, and it actually binds to cannabinoid receptors known as CB1 and CB2, and that is throughout the body in terms of the central and peripheral nervous system as well. Okay, so going back to the concept of medical cannabis and recreational cannabis, or also known as non-medical cannabis. When we're talking about cannabis in this session specifically, we're talking about the medical cannabis, and that is what patients are like in terms of patients taking cannabis for medical reasons. And that's generally general use of cannabinoids to alleviate symptoms. And that has been something that has been regulated, has been actually legalized in Canada since 2001. And that allows us to grant access to cannabis use for individuals with chronic pain, HIV, and a myriad of different illnesses or chronic conditions. And medical cannabis use is also not recommended for individuals under the age of 25 unless seen or having discussions with a licensed healthcare professional. And then when we're talking about recreational cannabis, this is where you're seeing your dispensaries, plaguing the cities in Toronto as well as Canada. But this is when we're talking about individuals who are just using cannabis for pleasure and the euphoric effects. And that was also legalized in 2018 for recreational purpose through the Cannabis Act. And it isn't something that is like free for all for cannabis use. So I just wanted to say that it is about having a strict guideline and legal framework to controlling the production and distribution of sales and possession of cannabis through Canada. But in essence, cannabis has been legalized in Canada since 2021 for medical purposes in itself. So I'll give a little bit about myself. So I am a sickle cell disease trait carrier in terms of it being a carrier. I do have thalassemia, but my story with cannabis use as a patient and being patient-centered is my lived experience with fibromyalgia as well as myofascial pain syndrome. So I was diagnosed with both in 2017, but my journey with pain and dealing with the symptoms associated with it has been since the age of 8 and 9. As many of you know who may have sickle cell or work with patients with sickle cell disease, chronic pain in terms of the daily impact on both physical and mental health, as an academic as well. And going through school, it obviously affected my performance and also quality of life. Conventional treatments that have been used for fibromyalgia and some are similar to sickle cell disease, like, your painkillers in terms of opiates and morphine. There's also trigger point injections. Knowing that this would be something that would be more chronic and something that would be long-term for me, I looked at other options with my physicians in order to help with quality of life as well as other options in terms of pain management. And this is where my journey started as a medical patient. So also, I like to say that cannabis is just one of the many tools in my toolbox to wellness, and it isn't an end-all be-all for me and for many cannabis patients as well. So within that pursuit of trying to find symptom management and working with my physicians, I found out about a lot more about cannabis in terms of understanding that there's just so many different methods of use for cannabis. So the most common that we know is like the inhalation of using, your joints or your blunts or your vapes. And then you have other options of like oral, which is your tinctures, as well as digestible oils, capsules, and using edibles. And then there's also topicals as well. So that is actually one of my favorites in terms of being able to rub creams on and using it throughout the day in terms of pain management in certain areas that hurt. And I like to usually say that within that scope of working with a doctor, and why we tend to push patients into working within a medical framework, is that you get to learn a lot more in having that monitoring of what works for best for you in terms of having access to quality and safe cannabis, but also being able to find what works for you. So cannabis is one of those drugs that are medicines that are actually personalized. So it is very important to work with healthcare professionals and providers. And I found that would be the most effective way for me. And I will talk a little bit more about the risk associated in terms of sickle cell patients in specific based on research. So with medical cannabis, I am just one of the 212,000 individuals within Canada that use are registered with medical cannabis. And on average, most physicians or healthcare professionals are actually registering individuals for medical purposes and are given 2.2 grams per day. And there's about over 5,700 healthcare professionals that are associated with registration with federal licensed sellers. So there are a lot more doctors that are open to working within or prescribing with medical cannabis within Canada. And some of the top reasons for medical cannabis use amongst all patients are mainly for pain, anxiety and depression, as well as sleeping problems. And we find that similar to, I guess, my experiences as well, that most medical cannabis patients are using a large range of cannabis, but in terms of being smoked, vaporized, consumed, and other topicals in terms of product availability as well. And also cannabis definitely has been used in terms of chronic pain, which I'll leave Shan to talk a lot more about pain management with cannabis, but other symptom management that cannabis has been known for in most recent studies is also sleep improvement, anxiety reduction, and mood improvement, as well as anti-inflammatory effects. And as you can see, that things like CBD that we had discussed in terms of the cannabinoids have been shown to have really calming effects to improve sleep quality, as well as with anxiety in terms of reducing or bettering the mood of individuals as well. So now focusing on sickle cell disease patients and cannabis. Chronic pain in itself is the most prevalent among adults with sickle cell disease, with 1/3 of patients actually that experience or have said to experience daily pain, and over 50% that had met the criteria of chronic pain within this study. For most patients, opiates are the mainstay treatment for sickle cell disease. However, there are adverse effects that have been noted in terms of death from opioid use, opioid tolerance, and dependency, which are usually major hurdles in terms of prescribing opiates for sickle cell disease patients. But even more so, a lot more patients are looking towards cannabis products to be used for sickle cell disease. So lots on the slide, but I will just kind of sum it up in terms of cannabis use for patients, for sickle cell disease patients, is being studied a lot more in the US than it is in Canada. And recently, in the most recent research, we're finding that cannabis use is being used for chronic pain, as discussed, to help with pain in terms of avascular necrosis, daily pain management, as well as to reduce significant opioid use. Also, we're finding that sickle cell patients are actually self-reporting that have often worse painful crises were more likely to utilize cannabis daily while lowering the visits to ER and hospital admissions. Again, it was reported that about 30% of sickle cell disease patients have been reported to use cannabis or to self-medicate and experiment on a monthly basis. And there has been underreporting of illicit cannabis use. So that is not getting cannabis from a actual licensed source. Again, there has been a lot of concerns around the risk of exposure, especially around sickle cell disease patients using cannabis in terms of self-medication, as well as experimenting and also getting cannabis from illicit cannabis use, which it begs a conversation in terms of having and what that model may look like for cannabis patients in terms of sickle cell disease patients, moving towards a more medical framework and working and with the supervision of healthcare professionals. So again, just to reiterate, data on cannabis use in sickle cell disease is limited. However, there are sickle cell disease patients that in Canada that are using medical cannabis within a medical framework with physicians. But again, there are major concerns around self-medication and experimentation. Within the scope of this work, we're looking really at sickle cell disease patient safety and considerations in terms of potential risks. So definitely there are a lot of risks in terms of self-medicating and experimenting. Also patients may not be fully aware of the risks associated with cannabis, and especially when consumed for health-related conditions. So we're looking at like drug interactions, possible drug interactions, without that supervision of a primary care provider, which is integral in terms of pain management, and also just management of sickle cell disease symptoms. And also we're looking at aspects of patient safety when we're looking at responsible use and avoiding misuse. So there are concerns in terms of addiction, similar to opiates, impaired driving, overconsumption of cannabis as well, cannabis disorders, and also cannabis-induced psychosis. So that is why it's extremely important for a lot of patients that are doing self-medication or experimenting to actually have those discussions with their healthcare professionals and within a Canadian context to really start looking at finding the methods in terms of working and collaborating with a primary care provider in order to get into the medical route, into medical stream or framework for cannabis. We're also looking at aspects of education and awareness. So also reducing stigma. So I think that's one of the biggest things that come out in literature is the stigma associated with patients and medical cannabis patients, to have those conversations that, yes, I'm using or I'm interested in using cannabis. So we're really trying to encourage a lot more patients to have those open dialogues, but even more so for doctors as well, to be open to having those conversations with patients to reduce risk. Also the dissemination and accurate information. So there is a lot of things out there about cannabis, but we're really hoping that through health promotion and that we can really guide conversations about what is the most appropriate, what is happening within research as well to reduce harm. So key takeaways in the interest of time is obviously the lived experience with cannabis is going to be different for everyone. It's not a one size fits all. And that is why it's so important to work within a medical cannabis framework. There is obviously evidence in terms of cannabis being useful in terms of helping and manage symptoms for sickle cell disease, especially for those who have chronic pain. However, personalization is key, but that also requires the integration of working with healthcare professionals in order to find a treatment plan that works best for you. Also, I found that in terms of my experiences is always documenting is a powerful tool for myself and to track and to have those conversations with my physician. So I'll leave it at that and pass it over to Flo as well as to Shan for the continuation of this session. Thank you.
Thank you so much, Aika. That was really insightful. Take it away, Shan.
All right, thank you so much. I will share my screen. Please bear with me for 1 second. Can you see my screen?
Yes, we can.
We can.
Okay, perfect.
If you can just put it, presenter mode. Thank you.
All right. Hi, everyone. Thank you so much for being here and for having me. I'm very pleased to be here today. And so just to add on to what Aika has already shared, I wanted to get a little bit more into the management of pain and sort of the clinical experience that I've had to share what I'm seeing and what patients are using. So we'll get right into it. So just a little bit about me, I'll be really quick. I'm a nurse practitioner, a family practice nurse practitioner. I'm also an Ayurvedic practitioner, which is East Indian medicine. So I practice both Eastern and Western, and I try to put those together. And I use a lot of plant medicine, and cannabis is one of those plants that I love working with. I have no potential conflicts of interest to disclose. And so I just wanted to start, I'm not going to beat this to death, but just to show the journey that we've been on in Canada. You know, at some point in time, cannabis was illegal. It was considered, you know, in the same realm as opium and other drugs. And so we've come a long way. Medical use of cannabis has been legalized since 2001. And then in 2018, that's when, you know, recreational or adult use cannabis became legal in Canada. And this is with certain guidelines as laid out here. So it's the Cannabis Act is there to allow the use of cannabis, but also to provide guidelines for safety as well. So as Aika mentioned already, there are certain things that we see very commonly in practice. And so the most common, the top three big ones are chronic pain, sleep and insomnia, and anxiety. And then we also see, you know, a range of other things, patients with MS, patients with cancer, seizure disorders, PTSD, depression, other mental health concerns, migraines, headaches, digestive issues, appetite issues, and skin disorders. But this is by no means the whole list. We see a range of people with many different concerns. Chronic pain, I would say, is definitely the top number one reason that people are seeking cannabis. And I know that's a very broad term. When we talk about chronic pain, we're talking about people who have had accidents and now they have ongoing pain, people who have arthritis or fibromyalgia, as well as we're talking today, as sickle cell disease and that type of pain. So chronic pain encompasses a huge range of different types of pain and different reasons for pain. But that is the number one thing that people are turning to cannabis for right now. So when we think about sickle cell disease, as all of you know, it's what we see is a complex type of pain. So there's the chronic pain, you know, which has been going on for many people for most of their life. It's there all the time. It's that pain that's always there. And then we have these episodes of acute pain as well. So it's complicated. It's not just one type of pain. There's nerve pain. The nerves are affected. So it's a very complex pain pattern. And it starts in different places as well. So we have pain that starts, you know, in our peripheral system, so in certain locations. And then we have pain that's coming from our central nervous system. So again, very complicated. And this diagram is just to show that, you know, with all the mechanisms of pain, the things that bring about that feeling of pain, cannabis and cannabinoids have the potential to act on all of these different mechanisms, and so can affect pain and help with pain at various different levels throughout our system. And so, you know, Aika has mentioned some of these things as well, but what we find is that about 30% of people living with sickle cell disease report that they have used cannabis for symptom management. And I always stress that, because many times people are hesitant to report that they are using cannabis, again, because of the stigma, because they don't want to be judged. They may be afraid to tell their healthcare providers that they are using cannabis. So, you know, my feeling is that 30% is on the low side, because I do believe that there are people who may not be reporting that they are using cannabis. Amongst those 30%, we find that about 30% of those are reporting daily use. And again, we have to consider the numbers and whether, you know, there may be more than 30% who are actually using it daily. You know, and pain is never just pain. Pain comes along with the way that it affects your mood, the way that it affects your sleep. It affects many other, we are all, every part of our body and system is connected. Our mind does not exist apart from our body. So, when you have pain, you definitely have other things that you deal with. We have seen that patients who are using it daily, they present to the hospital fewer times, whether it's the ER or for admission. And a big one, as Aika mentioned, is opioid use. So, the main treatment for the pain associated with sickle cell disease has been opioids. And we all know that this is a big, opioids have become a problem. There's dependence and there are all the side effects, and long-term use is difficult. So if we can have options in which we can, for some patients, they're able to substitute their opioids. For others, it's a matter of just keeping their opioid use low or keeping their dose low and using it in combination with cannabis. So it looks a little bit different for everyone. It's not the same for every single person, but it can play a role if people are wanting to kind of not use as much in terms of opioids. It's generally well tolerated. I mean, there is a lot of information out there about the many, side effects and risks. And, for the most part, we find that it's generally well tolerated if used with the proper guidance, and that's important. So just going out and getting, really potent cannabis can have a lot of side effects. And so that's why it's really important to seek medical advice, to talk to someone and get that guidance. So just a little bit more about THC and CBD and how they're used. So the plant itself has so many different compounds, as Aika mentioned, 130 and counting. So THC and CBD are the main ones, but definitely not the only. And the idea, when we think about cannabis as medicine or any plant as medicine, the whole plant has benefit. So it's the way that the whole plant, all the compounds work together, the way that it smells, the way that it looks, the color, all of those things contribute to the effect of cannabis. When you go to purchase cannabis, what you mainly are going to see is THC and CBD. So THC is the part of the plant that makes you feel high if you use enough of it, but it has its therapeutic value. So, definitely for acute, chronic, and neuropathic pain, THC is very useful. It's used quite a lot for the management of symptoms related to cancer and cancer treatments. It helps with appetite. It helps with falling asleep. So people who have difficulty with starting sleep, initiating sleep, THC does help. And it is used in supportive management of anxiety and depression. And I put an asterisk there because this, again, you want to do with the guidance of a healthcare professional, because if using the wrong product can actually have the opposite effect. It can make you more anxious or paranoid. And that's, we definitely want to avoid that. We don't want that to be a part of your daily life. And then on the other hand, we have CBD. So CBD does not make you feel high. It's a very powerful anti-inflammatory. It helps with chronic pain management. So I wanted to differentiate there because CBD helps a lot with the inflammatory process, which is a big part of pain management because so much of our pain is related to inflammation. But we find that THC seems to help a little bit more with acute pain and nerve type pain. So any pain that's related to nerves. So just wanted to mention that. Muscle spasms, spasticity, CBD does seem to help with that. And again, with sleep, if you're using THC to fall asleep, CBD then helps you to stay asleep and have a better quality of rest. And again, with the supportive management for mental health concerns as well with guidance. And so the formats, I know Aika went over this as well, and I don't want to belabor the point. It's just that we have different formats, and it's very important to choose the right format or the right combination of formats in order to get the effect that you're looking for. So Inhalation is what we're kind of used to seeing, that's smoking, the flower, vaping. It's very quick acting, so it starts to work within 15 to 30 minutes, and it stays in your system for about 3 to 4 hours. So, this has a role. I'm not saying, as much as we don't encourage smoking, for medical reasons, we would probably recommend using a vaporizer. But the reason that this is important still is that it helps with quick relief. So for people who need immediate relief, you're having breakthrough pain, you want to get to sleep very quickly, inhalation does have a role there. Because of the increased risk of chest disease for sickle cell patients, we do want to use in caution. And so that's why I say safest possible route is vaporizing. I also want to mention in this category, it's not inhalation, but there are sprays out there. So like an oral spray that you would just spray into your mouth, which can mimic how quick it works. So it mimics smoking in that it works very quickly, and then it's out of your system in a shorter time. Then we have ingestion, which would be the oils, the capsules, and the edibles. So these take a bit longer to start working, 30 to 90 minutes. They then, once they start working, they stay in your system for 6 to 8 hours. So here is where this method is good for long-acting relief. So this is more of a daily maintenance for pain, for sleep, for mood. This is sort of your baseline treatment. So if you think about medications like opioids or other pain medications, this would be like your long-acting medication, whereas the smoking or vaping is your breakthrough, so the quick acting. Having said that, we do have to consider the long duration of action. So, you need to allow yourself enough time. If you're using it for sleep, for example, you don't want to take it 3 hours before you have to wake up and go to work, because it's still going to be in your system. If you're driving, you want to consider that as well. So the fact that it works for a longer time is a benefit, but we also have to consider what that means for each patient in their life and what they're trying to do daily. Usually well tolerated. For some people, they don't like the oil. It has a taste. It does taste like the plant. Sometimes it causes stomach upset, but not very often, I would say, but it is still something to be aware of. And then we have the topicals. This is often a really good way to start using cannabis. So if anyone is hesitant to ingest or to inhale, this is a very good starting point. It does not go into your bloodstream. It does not cross your blood-brain barrier. So when you apply a topical, you apply it to where it hurts, and it works there. It lasts, I would say, about 4 to 6 hours. So often you do have to reapply it throughout the day. And then for some patients, I know it is difficult to apply depending on where the pain is. So if it's on your back, and you're by yourself, you don't have anyone else to help you, that can be a consideration as well. There are a whole range of these. There are creams, balms, salves. Now on the market, there are a lot of bath-related products, which are great for just soaking, kind of like an Epsom salt bath. And, there's roll-ons, gels, all different types. And again, like anything else, it's a bit of trial and error. You have to try it to see how it works for you, how often you need to put it on, what type of relief you're getting from these products. Just wanted to point this paper out. This is a recent paper this year, 2023, that was published by Dr. Bell from the University of Toronto. So this paper is one of the first of its kind. It's a clinical practice guideline for the use of cannabis for chronic pain. And so this, for healthcare providers who may be hesitant to use cannabis or prescribe cannabis, or even, we find it's difficult to even have that conversation with your patients if you feel that it's not something that you know very much about or you're not comfortable about. And sadly, there is still a lot of stigma in the medical community. So I will say that. And, you know, having practice guidelines is sort of our standard for recommending things. So, you know, someone has reviewed the literature, they've put together guidelines. You know, this was a massive undertaking by a group of people. And so this is a starting to, you know, encourage medical providers to incorporate cannabis as part of treatment plans by providing clinical guidelines. I just wanted to briefly cover the medical cannabis process, and this, I apologize, applies in Canada. So this is our process here. You know, it starts with the consultation, which is a discussion about your history and, you know, what you're currently using, how things are going, and determining whether cannabis is appropriate as a treatment for you. You know, we have to consider the medications you're taking. We have to consider your disease process, your overall body function, your liver, your kidneys, things like that. And so we determine if it's appropriate. Once that happens, we create the prescription, which is the medical document. And in Canada, if you're a medical patient with a prescription, you purchase from a licensed producer of medical cannabis. So there are certain producers that are designated medical, and we send our patients to them. The patient will register, and then everything happens online. So you buy the products online, you know, based on the recommendations you've been given. They come to you in the mail to your home. You sign for them, and then you're ready to use them. And so this is the process here. Can't speak to what it looks like in other countries, but this currently is our medical process. And that's all I wanted to say. I wanted to leave some room for questions, and I thank you all for being here and for having me once again.
Thank you so much, both. That was really great. Yeah, we have some questions already. Etta mentioned the salt bath. I would like to use that. So do I have to ask my doctor, the primary, or hematologist?
I would say both. I think it's always good to incorporate everyone that's in your care team just to let them know what you're doing. You know, it's a little tricky to navigate just determining who is open to having that conversation. But as our own advocates, we just have to bring it up and see what the response is. In Canada here, we have a lot of medical cannabis clinics. So if you're finding that on your own health team, you're not really getting very far, you can consult with a provider at a clinic just to get some recommendations, and maybe, you know, if you need a prescription to go through that process. But the bath products are, you know, they're not going to go into your bloodstream. They're not going to your brain. They're quite safe to use, and they're very effective for pain management.
Okay, thank you. We have a few more. Karen mentions, I'm curious if the pain you were experiencing was ever attributed to your sickle cell trait. We are seeing more patients with similar symptoms for trait patients. So curious if that was ever a discussion.
I think that was me.
Yes.
So that was actually a concern as well for me, Karen. So it was never attributed to sickle cell trait. After doing a few tests and whatnot, it was always associated with fibromyalgia and myofascial pain syndrome. But there has been a lot more research, especially with actual sickle cell disease patients with trait as well that have fibromyalgia as well. So there is, as I was getting prepared for this presentation as well, there was actual connections and research, but it was so limited. But thank you for the question as well.
Thank you. We've got another one. Who prescribes your cannabis? Family doctor, hematologist, interested in topical for leg ulcers, but not sure the hematology team would feel comfortable with this. So would like to know your experience around this.
I think that's a me question that might be also Shan May if you want to pitch in as well. But in terms of my cannabis, my family doctor actually referred me to a pain specialist for chronic pain management. And lucky enough, the pain management clinic actually is a medical cannabis clinic as well. So also another doctor that is well known within the medical cannabis space within Ontario. So I was lucky enough to get referred to him. So during that process, that was a little bit easier for me. It's not always the same for a lot more people, but as Shan May had said, there are medical cannabis clinics similar to the one that I attended or I go to for cannabis management in terms of my pain and treatment plan. And I did see, and also, yes, there are interested for topicals for, so there is a few research because I had actually did some research while Shan May was doing her presentation on like ulcers and topicals, but there is some information, very recent, actually, one that was actually released this year in January of actual topical use for like ulcers for sickle cell disease patients. So I can definitely send that over, but there is some evidence in terms of effectiveness and just looking at it, but it is very under researched. A lot of the research around sickle cell disease and cannabis use, as Shan May, obviously, in terms of our research and literature review, is really focused on chronic pain management, and there's less on the other symptoms associated with sickle cell disease in itself in terms of specific management and treatment that I've seen, at least.
I just wanted to add for topicals, yes, that we do see them being used for inflammatory skin conditions, so like eczema, psoriasis, that sort of thing. When you're using for ulcers or anything open, I would just be cautious with that. And one of the things we also have to consider with topicals that I think is what is in it, because a lot of times when the topicals are made, things are added to it. So there's camphor, there's menthol, because they're being used for pain, people put essential oils in them. So it's really important when you're using a topical that you look for something that doesn't have a lot of these added things, because those things can actually irritate your skin if your skin is fragile or you're having, you know, ulcers and things like that. You want to really look for topicals that don't have all these added ingredients.
Thank you. We have another question. Are there any signs or adverse effects one should be aware of when using cannabis as a pain management method?
So I will say, you know, it's not without risk. So the main side effects that we would see are generally related to THC. So, you know, you may feel high if you're using a certain amount of THC. There's a bit of dry mouth that goes along with THC. There is sleepiness, depending on the strain, you may feel sleepy. And I would be really cautious in using anything that has a higher THC percentage, because then we get into things like anxiety, paranoia, and which we're trying to avoid. CBD is very well tolerated. There is very minimal side effects. Mainly, I would say sometimes with CBD, it doesn't make you sleepy, but it has a sort of relaxing effect. So if you're used to being very like tense, or you're living in a state of tension and you take CBD and you feel relaxed, you might feel sleepy, but it's not because it's sedating you. It's just because you're kind of having a new feeling of being relaxed. But otherwise, you know, it's very well tolerated, and CBD is definitely a good starting point to just get used to cannabis and how it works.
Thank you. I'm not sure who this is for, but said something about cannabis-induced psychosis. Is this a disincentive to use it for any reason?
So I mentioned it, but I think Shan May can add a little bit more context to it. So from a mental health perspective, I guess with anything that you use in terms of even opiates, you know, morphine, etc., there is going to be elements of, you know, concerns with mental health. So like Shan May had also talked about, it's about starting slow, especially with the levels of what like THC, etc., that you're using. And what we're finding as well from a mental health perspective and also access is that from illicit use. So those who are not getting cannabis from the, you know, medically or from quality in terms of licensed producers, you're finding that what you're being given is not necessarily what it is. And it can be mixed with a bunch of different things, products. It can have really, really high extreme THC limit, THC levels, and it can actually encourage or cause or create instances of psychosis or cannabis-induced psychosis. So that is why we really push for patients to not self-medicate and to not to do experimenting, and to go through the medical model of actually being supervised with, and going through that treatment process with a healthcare professional, rather than just, going on your own and going to even a dispensary and saying, I'm going to take something that has 30 mgs of THC, because I think this is what's going to work. This is why we really try to encourage, and also starting slow in terms of microdosing as well. So really starting in small increments and building up in terms of supporting and to actually reduce the chances of cannabis-induced psychosis. I don't know if Shan may has anything to add to that, but.
Yeah, I definitely agree with Aika. A lot of the information that we get that sounds a bit scary, it's from the past. It's based on THC. Often cannabis that was illicit, you were getting it from somebody in some place. You didn't know what you were really getting. It might have been really high in THC. It might have also had other things like pesticides and other chemicals. So it sounds scary, but it's not a common thing. So this is not common. It's not happening to everyone who uses cannabis. And by having someone to guide you, taking that slow, steady approach, we can avoid, those types of side effects.
Thank you. We have a few more. Why isn't cannabis prescribed for use by children? Hydroxyurea started for adult use only, but is now used even for babies.
So I'll start, and then Shan, you can take after me.
I just want to interrupt real quick to just remind everyone that this is not medical advice, that you should always speak to your medical practitioner. Thank you. Go ahead.
Yes, please. So there is actually cannabis is being used for children in terms of pediatric care, especially around epilepsy. However, what we're finding is that if you are going to go through the medical route of looking at cannabis use for pediatric use, that is definitely something that needs to be done with a licensed health professional and also with a specialist, given whatever you're needing in terms of symptom management. But there is research, and there has been a long history of cannabis use for pediatric use, but especially for epilepsy and certain conditions like, cancer and also etc. However, we are mindful that in terms of data showing that, early introduction to cannabis for childhood development, if you're doing it in a non-medical route in terms of recreational use, especially around adolescence, etc. So I think I'll leave it at that and then have Shan continue.
Thanks, Aika. So very complicated topic. So in medicine, we have to rely on studies. We have to rely on evidence. And so a lot of medical providers are very hesitant to prescribe cannabis to children because we just don't have evidence. We know that the brain continues to develop until the age of 25. So we have to exercise a lot of caution. Having said that, I do prescribe to children with a lot of caution. So as Aika mentioned, for children with seizure disorders, and parents are coming now for children with autism, because when you've tried all the pharmaceutical options and you're feeling like you have no options, you're looking for a safe alternative that may change the life of this child. So again, even with chronic pain for children, we're slowly getting there, but it's a very cautious approach, and 100% you have to do this with a healthcare provider. I know it's a challenge to find someone who will prescribe for a child, but it's essential that you have someone to guide you.
Thank you. Tunde says, excellent presentation. And they ask, can I travel to Europe on vacation or visit with my medically prescribed cannabis? I don't know if you have any insight to that.
So unfortunately, even with a medical prescription, we cannot leave the Canadian border with cannabis. It's just a no-no at this point in time, just because every country outside of cannabis has a varying legislation on cannabis. So for now, even if you are a medical patient, we're not allowed to travel anywhere with it.
Thank you. We have another question. I had also heard that we should strongly discourage inhalation of cannabis for sickle cell disease patients because of what you said around acute chest. But I'm also wondering, does cannabis reduce oxygen carrying capacity to the tissues?
That's a great question, and I'm definitely not an expert on that topic, the hematology aspect. The way that cannabis is metabolized is in the liver. And so when we think about inhalation, it's just the fact that the smoke is going through your lungs, and that, with anyone with acute chest or just at risk for chest disease, we want to avoid that. There's conflicting evidence because people with asthma, there are reports of people saying that they use it to help kind of relax their muscles, relax their lung tissue. And so it's a bit mixed, but from a cautionary point of view, we have to say like inhalation may not be the best. From a cellular level, in terms of oxygen carrying capacity, from what I understand, it does not diminish the oxygen carrying capacity of the cells. It's more so the smoke that we're worried about, like the actual inhalation, the combustion of the plant material. And that's why we would recommend a vaporizer if you're planning to use flower or inhalation.
Okay, thank you. That concludes all the questions that we have, but a few people are wondering how they can get in touch with you. So if you're happy to share how best for them to do that.
I will put my LinkedIn and my email in the chat box, if that's probably the easiest.
Thank you. That concludes our session. There has been a poll that's populated, so if you could please fill that out. And thank you everyone for joining. I feel that was very insightful, especially with such a topic that is, quite new and quite controversial. So thank you both, Aika and Shan Mei, for joining us, and for everybody.